Martin, what does it pronounce?
That's not my name.
Yeah.
Wait, the original speaker, she had a last-minute emergency, so she couldn't come. So I'm going to present the word for her. But it says Renata. Renata. That's her. The original speaker was myself. Okay? So this word, I was going to say, Konnichiwa, minasan. Watashi wa Paula desu. I am Paula. I'm going to present this work. The title is Academic League, a Peculiar Medical Teaching Strategy. The purpose is to talk about LINUC, which is the Academic League of Neurology of UniCity. LINUC is one of the multiple academic leagues of University City of São Paulo Medical School. And academic leagues, for those of you who do not know, they intend to promote a deeper knowledge in a medical field, in particular that is of interest to the students, through case discussion, lectures, medical practice, and research as an extracurricular activity. This study focuses on LINUC, which is the League of Neurology of UniCity. We evaluated how much LINUC helped its members to improve their knowledge about neurology, comparing the members' admission tests into the academic league, and then after 3, 12, 18, and 36 months per year as a participant. We analyzed the tests of 11 members from different academic years and months as participants. As a result, the results showed an improvement from all members, and the longer they had been in the academic league, the further was their improvement in the test, with a maximum improvement of 7.8 points, or 780%. And even those that were only 3 months at the academic league, there was an average improvement of 1.2 points. So we concluded that the academic league, LINUC, had a major impact on the academic and professional life of our members, especially on their neurology knowledge, encouraging our students to become better medical doctors.
So, any questions or comments? So, I want to see the contents of test.
Okay.
Yeah.
They were about, one of them was about epilepsy. There was another question about stroke, and there were multiple tests, multiple choice tests, multiple choice questions that gave us a case, clinical case, and we had to do the right diagnosis. But there were mainly multiple choice questions and and there were written questions as well.
So, what about the skill
You mean practice? Yeah. About the practical? Well, in LINUC, twice a week, we see patients. We do the interview and everything. Then it's like in the hospital, but it's like in the not as difficult as in the hospitals but weekly we see patients by ourselves. Then we discuss the case with the teacher, and the teacher ends the station.
At this point, the student can be see the patient
By himself?
By yourself.
Yes, actually, we always see the patient by ourselves, but when we just enter the league,
You can lead the correct diagnosis and
sometimes it depends, because some cases are really complex, so we don't know. But like headache and those small things, yes, I think we can do that.
Are you a member?
Yes, I am. I used to be, actually, because now I'm the fifth year.
All of people.
No, maybe.
or comments? Thank you. Okay.
Next one as
Oh,
well.
okay.
Right.
Please start.
Quer que eu corte com essa de novo?
This works about the use of drugs by medical students before the exams, and we wanted to verify the causes of sleep deprivation in medical students during the exam season. So, as
Muito
a
parecido com o
method,
seu.
we formulated a questionnaire composed of 6 questions, and those questions they evaluated the number of hours slept during the night, changing the amount of sleep hours during the exam period and in the night before, and whether there was a greater occurrence of dreams and nightmares or not. And also we questioned about the use of drugs in this period. So the results showed that out of 72 students that were evaluated, 76% of all students report a change in the amount of sleep hours due to 3% said insomnia here, 49% said they were studying, 12% said they couldn't sleep because they were anxious, and out of those students that said there was a change, 18% said they spent the whole night awake before the exam. And then 35% said they had excessive dreams or nightmares. So out of the 72 students, 29% of them use drugs. 29%. So 21% of the whole bunch, of the whole 29%, said they use caffeine-based drinks, like coffee and stuff like that. 3% said they use other stimulating drugs, such as sibutramine. Do you know sibutramine? No? Okay, amphetamine. Sibutramine is a medication to lose weight as well. It gives you a weight. So, and 1% said they use sedatives, hypnotic drugs, and 3% use alcohol the night before the exam for some reason. So we concluded that the period of exams causes serious sleep disturbances in medical students, and they feel stimulated to use drugs in order to decrease anxiety and increase concentration. We propose inclusion in the medical curriculum discussion about those aspects to minimize the potential damage of those attributes, so the students can learn how to better manage anxiety and stress, which we know is a big problem with students. Arigatou gozaimasu.
So,
Mixture about the coffee. Coffee or tea.
Stuff with caffeine, tea as well, coffee, and energetics.
Coffee or tea.
Coffee is dark, tea not so much. Yes, they drink every day, but they increase the amount of intake. The intake is increased in the night before because they want to stay awake.
the lifestyle of these students is the same in all of my estimate.
Yeah, I think so as well.
You do think so? Okay. So, next thing, it seems to be a problem. The student easily take medicine, except coffee or tea, except coffee or tea. So, if you propose to the university, you may emphasize the two drug use. How about this paper? Any comments? The reasons studying and is different from other anxiety and insomnia, quite a different reason. So, how do you think about it?
Well, I think they are associated, they are related, because anxiety, you're always anxious when you have an exam the next morning. Yes. So I think those who have insomnia, they are really anxious. They should take some medication for anxiety, probably. I don't know, the case is different. But, well, the thing is, studying shouldn't be done in the time. It should be done throughout the semester, and some students just leave it to study before, and that leads to this.
The student is studying hard in Brazil than harder than other countries. The students in Brazil must study harder than other countries.
Well, I think in Japan it's worse. Culturally.
How about the usual life? There's no examination.
Not as hard as some other places. Yes, they study a lot.
Pray more.
They
Pray. Enjoy your life
Yes.
without studying.
Well, yes.
Before exam, you must study hard.
Oh, study hard before the exam?
The situation
Yes,
is
yes.
quite same to same in other countries.
Yes.
Okay, so how about this paper? Comment? Is there any comment? Nothing? Okay. Thanks.